Looking out a dirty old window, down below the cars in the city go rushing by. I sit here alone and I wonder why. Friday night and everyone's moving. I can feel the heat, but it's
All right. Welcome to Growing Up in America. It's Dr. Bob along with Bree. Bree, how are you doing this morning, by the way?
I'm so good. It is a beautiful day, Dr. Bob.
It is. We don't always have a lot of those, but we're excited to have one. So it's going to be a good show. We have a lot of great guests. So we're running down the list. We have pediatrician Michelle Lopez is going to be on the show. We're talking about, she's one of the editors of the Journal of Applied Research on Children. Dr. Geoff Gusoff, family medicine specialist. He's out at UCLA. We're going to be talking to him a little bit about the social determinants of health. Aleah Martin, Youth Build Houston, that should be good. And Christian Salas, talking about his work as social work. It's Social Work Month. And what other little tidbits do we have going on here, Bree?
You know, I do want to back us up just a little bit, Dr. Bob.
Yeah.
I want to welcome all of our viewers and or all of our listeners to
Yes.
Growing Up in America here on 90.1 FM KPFT.
There you go.
Yes, we love this program every Wednesday, 9 a.m. But also, we are going to be doing one of our special segments. So we have our Hip Speak with Rebecca George, of course, and I have no idea what she's bringing
wow,
us. So
that's
it's
good.
going to stump us, I
Yeah,
think.
yeah.
But we also have our Data of the Day with Dr. Data.
Oh, good. And do we have a number?
We do.
What's
It's
the number?
51%.
Ooh, 51%. What is that? 51% of Americans don't get it? Maybe.
If I may offer a complimentary guess here, because that's perfect. I think 51% of Americans think we're living in a simulation right now, just based on last night.
I did not watch last night. I just couldn't bring myself to do it. Did you?
Same. I couldn't bear it.
Yeah.
My partner did, and I was like, nope, we're going to go watch some reality TV because
Yeah.
that feels better.
Yeah. Wow. Just something else. So I'm sure we'll all be informed about it too, because all of our friends are going to have watched this. And so anyway, I'm off to New York City tomorrow, so I'm sure I'll get a whole dose of what's going on there. So it's should be interesting, but a good program right here on Growing Up in America, KPFT. So coming up after the next musical break, we're going to be visiting with Michelle Lopez, talking a little bit about the Journal of Applied Research on Children and a little bit about the social determinants of health. We'll be right back here on Growing Up in America.
turn the lights on, lights on, lights on, lights on. Every night I rush to my bed with hopes that maybe I'll get a chance to see you when I close my eyes.
All right, you're on Growing Up in America. We have Michelle Lopez with us. Dr. Lopez is a pediatrician here in Houston. She's one of the editors of the Journal of Applied Research on Children. We're talking a little bit about social determinants of health. Good morning, Michelle. How are you doing today?
Hi, good morning, Dr. Bob. I'm doing well. How are you?
Very good, very good. So, Dr. Lopez, I wonder if you might start off by giving us a little bit of an idea of what social determinants of health are. I was last week in San Antonio, and we had a whole conference on the social determinants of health. And what I realize is a lot of people don't fully understand it, right? They think it's just health, but it's sort of this broad definition of how we get to healthy children.
Yeah, exactly. So really, I think the best way to look at it is the conditions in the environment where children born, live, learn, and grow. So it's kind of everything surrounding the child's environment, and all of those factors have important implications for their health outcomes.
And how does it impact you as a pediatrician, Dr. Lopez, when you're thinking about the social determinants of health, and where's that intersection with your pediatric practice and how you sort of treat children in a clinical practice?
Yeah, so it's interesting. I, from a very early age, started thinking about the intersection of social determinants of health and health outcomes. My mom was a nurse in an underserved clinic, and so many of her stories about work weren't about the actual medical care. It was about these other factors that now we call social determinants of health, and how those were barriers to a lot of the patients achieving their best health outcomes. So it was always very much intertwined for me. I thought a lot about each patient. Each family has their own stories, their own complex factors that they're dealing with to take care of their children. And so that has continued throughout my career, and something that I've seen in my practice. So listening to parents, hearing their stories, providing empathy, understanding their perspectives, knowing one size doesn't fit all in medicine, and really working with families to collaborate on plans based on what works for them and based on their social determinants of health.
And Dr. Lopez, I know you grew up in the Rio Grande Valley, and when we look at the Rio Grande Valley, we see a lot of poverty. We see a lot of kids that are sort of struggling, families that are struggling to succeed. Did that have an impact on you as you had this sort of bigger view of the social determinants of health?
Yes, absolutely. I mean, my family grew up in poverty, and my parents were able to use education to improve our family circumstances. But it was definitely all around me, experiences, and also in the community. And I was very motivated to work to address these factors and to consider that. I went on to actually do a public health training because it was so important to me, this intersection of the medical piece and the public health piece, and how you really have to address both to get to where you want to be with health outcomes for children.
I love this perspective on just like holistically approaching health because, like you said, everything impacts it in so many ways. And so when I was reading this journal article and really just the journal in general, I noticed a shift from like individual behaviors to kind of this broader social factor, like what you're describing here in child health. So how do these articles contribute to the evolving conversation overall?
Yeah, I'm so excited about this issue. And so we have several of the articles published already. We have more to come, but the authors did such a nice job of thinking about exactly what you're saying, Brie, kind of that bigger aspect, how the socioeconomics and policies impact children's health. So Dr. Gusoff, for example, talks a lot about medical financial partnerships and how this can be a means to help with family financial security. Dr. Barnett touches on a really important issue with housing insecurity, and that's very complex to address, but she gives practical ways to do that. And then Dr. Gunderson highlights the SNAP program, Supplemental Nutrition Assistance Program. And we know that food insecurity prevalence is so high, and he talks a lot about how helpful SNAP is for patients.
Dr. Lopez, I know that the whole idea around the social determinants of health is not something new, right? This whole idea of this holistic approach to how children and families are growing up. But do you think that, now that we've sort of, there's more research and more people are seemingly talking about it, is it having an impact on pediatricians and physicians around the country?
Yeah, I think that's a really good point, Dr. Bob. It's not new. One of our earliest pediatricians, Dr. Jacoby, was talking about this, a century ago. And so it's not new, but we are now more academic in how we approach it and doing research as we have with the JARC issue. And I'm seeing now education and med schools around this. That's changed since I was a medical student. There's more of a focus and understanding this intersection. And so I think all of these things making it more academic is advancing the conversation.
I'm glad you brought up that scholastic aspect to this because I feel like as it's more present in training and classrooms, it's also a result of this kind of social pressure or the social expectation that we address these things as well. And so I know providers and clinicians are so busy. So as people are kind of struggling with time and workload, how does this play into it? And are there any strategies that are effective to balance responsibilities that are holistic but also patient-centered?
Yes, yeah. So it is a challenge, and one thing that has come with this is I've seen a shift in our culture where there was a lot more focus on the individual, and I mean sometimes even individual blame for compliance with health. And now we kind of recognize there's so many factors, so much complexity that goes into every patient being able to follow the health recommendations. And so, as a pediatrician, some of the things I teach my students are the importance of listening and patient-centered communication, understanding the family's perspective. So going back to that piece of really just being a partner for the family and being able to understand the challenges they're facing. And I think that's really helpful when I teach that perspective to students.
Dr. Lopez, as an expert in social determinants of health, and if you look at this whole picture, one of the things I asked a panel in San Antonio last week was, is there an area that we should be focusing a little bit more on? And so when you look at this whole thing, is there an area that maybe you wish that in the United States or in Texas or in Houston, we were focusing just a bit more on because it could be have a significant impact on the life of a child?
Yeah, so it's tough because clearly all of these areas are interrelated, and it's complex. And there's the areas that I think we've advanced so much already, like food insecurity, and healthcare institutions are doing so much around there, and we're really primed to have big immediate impact there. But I think looking towards the future, I really like Dr. Gusoff's article on medical financial partnerships, because so much of the social determinants of health comes back to economic stability and addressing poverty. And so a lot of the work that he's done and talked about is related to financial coaching, providing free tax filing for patients, and addressing those economic drivers of health that then tackles so much of the social determinants of health.
Mm-hmm.
That's just the economics are really just so important. And so when I think of economics, I also think of like housing quality as well, right? And like stability and how that impacts health. So is there a role for pediatric healthcare providers in addressing housing insecurity, do you think? How do we even begin to talk about that?
Yeah, this one is really tough. I think this is one of the toughest areas that I address in practice, because there's a lot of need around housing stability, around rent utility assistance, around families just having unstable housing. And so it's a challenging area. I thought Dr. Barnett did a really nice job of breaking down how pediatricians can address it with awareness, adjustment, and assistance. Is the approach that she presented. And for example, a child with asthma, it's really important that I, as a pediatrician, understand their exposures to their asthma triggers. And then from there, work on adjusting their plan. They might need more controller medication. They might need closer follow-up to prevent some of those ER visits. But simultaneously, I should also be addressing why their housing is contributing to worse outcomes with asthma. And so that might be through a medical legal partnership, or there might be other ways that I can help improve their home environment. But it's so key. It's really challenging to address, but so key, and an area that is very important for pediatricians.
So a lot of people don't know that Dr. Lopez is one of my favorite pediatricians in the whole world. And Dr. Lopez also knows I have a lot of friends that are pediatricians.
I was going to say, I'm not going to tell your other pediatricians friends, Dr. Bob.
Oh, they already know. They already think I say this to everyone, but I'm saying this to Dr. Lopez. And so I want to ask you sort of a fun question, because usually we end the show with some fun questions, Michelle, but I wanted to ask you, for you growing up, what was your just completely off topic, your favorite TV show as a kid growing up that really sort of delighted you as a child, Dr. Lopez?
Oh my gosh, Dr. Bob, I have no idea. Let's see, you caught me off guard. Let's see.
Yeah, that was the plan. Bree told me time and time again, do not go off script with Dr. Lopez.
I think maybe Sesame Street.
Sesame Street. Yeah, that's for a little kid growing up in the Valley who becomes a doctor, Sesame Street is sort of the perfect favorite show. It's Electric Company would have been another good one. Did you have Electric Company when you were a kid, Michelle?
I did, but I don't remember getting to watch that one as much.
Yeah.
But for sure, Sesame Street was a staple. So
yeah.
And I really liked all the characters.
Yeah.
And that I hadn't thought about that, Dr. Bob.
Well, very good. Hey, Michelle Lopez is a pediatrician here in Houston, and one of the great ones. She's one of the editors of the Journal of Applied Research on Children. Thank you so much, Dr. Lopez, for being with us today here on Growing Up in America.
Thank you for having me.
All righty. Take care. Coming up in our next segment, we're going to continue with this theme, and we're going to visit with Dr. Geoff Gusoff. He's a family medicine specialist out at UCLA. We'll be talking about his article in the Journal of Applied Research on Children around the social determinants of health. We'll be right back here on Growing Up in America. You're listening to Growing Up in America. It's Bree Derry, Bob Sanborn here with you. And so far, we focused a lot about the social determinants of health. We're going to continue with that. Dr. Geoff Gusoff is with us. He's the family medicine specialist out at UCLA. And his recent article in the Journal of Applied Research on Children is Addressing Economic Drivers of Health in the Clinic. Dr. Gusoff, how are you doing this morning?
Doing well. Good morning. How are you?
Very, very good. Thank you so much for being with us. So when you look at the social determinants of health, Geoff, I wonder, talk a little bit about sort of these economic drivers. I mean, one of the things that we always tell when I'm speaking to big groups, I say surprisingly, and a lot of people don't get this, I know you do, that, in many ways, your zip code, which is sort of a reflection of your family income, is going to determine your success in life. Unfortunately, there are some that break the odds, but by and large, that becomes this thing. And talk a little bit about these economic drivers and how that could have an impact.
Absolutely. And I think that's right on about the zip code. We say often the zip code determines more about your health than your genetic code. When we talk about, we look at the research around what affects health, about 10% of people's health is determined by what happens in the clinic, things we can do around medications, counseling, things like that. At least 50% seems to be related to these economic factors that people experience. And every day I work in the clinic, that's always something that is working in the background. We might be talking about diabetes or blood pressure, but what we're really talking about is the means that people have to address those things, whether it's affording their medication, whether it's affording the right food, whether it's the housing they live in, if they have stable enough housing or a job that is stable enough that they can kind of live their lives and just meet their medical and basic needs. So I do think that this is such a fundamental issue. And I know with Dr. Lopez, you were talking about how it's starting to kind of become more prominent, but we've known this for a long time. What's exciting now is that there's some more tools to start addressing these factors, even in the clinic.
Do you get a feeling, Dr. Gusoff, that, the medical community is beginning to embrace this? But how about outside of that, policymakers? I feel like sometimes when we talk about social determinants of health, they go right to health and they start talking about Medicaid. And indeed, it's so much bigger than that. But do you feel like policymakers are going to gradually come along as well without making it a political issue?
I think so. I think that there's already the beginnings of that, but I think there's a lot more work that has to be done.
Yeah.
I think exactly as you said, when people think about health, they just go one step removed where they say, all right, do you have transportation to get to the doctor? But we're not talking about that as a social determinant of health. We're talking about these big picture ideas about, do people have the stability and security they need economically to just lead healthy lives? And I think that there's a lot of policies that have been proven to get us there, but I think we need to make that link even stronger for people.
So one of the things, my wife has relatives in Sweden, so we go over to Sweden all the time. And I often, when I think about social determinants of health, you look at a country like Sweden, and believe me, living in Texas, the last thing the Texas legislature wants to hear about is Sweden. But it's really sort of interesting how everything is embraced there. They were at my house one time and they were trying to work the remote, and I said, well, we have the remote down here, but you guys solved poverty, we solved the remote control. And it's interesting how they have this bigger holistic approach. And is that something? I mean, certainly I've seen it in Sweden, some European countries. I mean, are Scandinavian countries some of the better examples for cultures that embrace the social determinants of health?
Yeah, I think that, one of the main drivers of a lot of these problems is economic inequality, and where you have more extremes in that, we see worse health outcomes. And certainly the Scandinavian countries, among others, have some of the lowest levels of economic inequality, and that translates into better health regardless of the health care that you're providing people. And so I think that there are models there, but there's also models East Asia has, in Japan, they have low levels of inequality. There's other models even across different states in the US. So I think there's a lot of place to draw for inspiration. People have their kind of favorite things to point to, but I do think that really thinking about, some of the major economic factors and how things are organized in a way that gives people opportunities and stability is really what you need to focus on in terms of finding the right model.
So kind of just bringing it back down to a more direct conversation here, a little less broad, a little less worldly. Thank you, Dr. Bob, for that always.
Sure, yeah.
I am very curious about your article, and you discuss a lot about medical financial partnerships. So can you tell me a little bit about what that is and why they are an effective bridge between healthcare and economic well-being?
Sure, thanks. Medical financial partnerships are these programs that have emerged really over the past 10 years that are based in healthcare settings, usually clinics, and provide access to financial services. And those services might include free tax filing that allows people to access tax credits they didn't really know that they were able to access. Or it could also involve financial coaching, coach sitting down with you and going through, do you have debt? Where are places you can save? What are your goals? Things that have been proven to improve people's financial health, but also their physical health. So the idea of the medical financial partnership, it provides clinics tools to address these economic drivers of health that we in the past haven't really been able to do from the clinic.
Do you find, Dr. Gusoff, that the trust that people have in their physician and in their pediatrician sort of helps in terms of addressing some of this stuff and having maybe not so much access to where to go, but being able to tell them these are things that you guys need to do to sort of have a bigger impact on your health? Is that part of it? I mean, it seems like in our society, if you stay away from vaccinations, people still have a lot of trust in their pediatrician. Is that sort of what you find works for you guys?
Absolutely. I think that to do the work that we do and to have the privilege to be involved with some of the most intimate decisions people make about their own health or their children's health requires a lot of trust. And we're constantly trying to work to make sure that we are trustworthy. And I think as part of that social capital, if you will, we can also be a trusted messenger around some of these other resources that people might not know about or might not be able to trust, because a lot of times they say, hey, you can get this, $1,500 tax credit, $2,000 tax credit. That can easily sound like a scam if you're getting that from another person. So I think that being a trusted messenger as a primary care clinic, as nurses, doctors, I think we can often help to get these messages through in places they otherwise wouldn't.
I think it's amazing just kind of adding that trust component in there. And I know, as we're talking about this really innovative partnership model, I can't help but wonder, like, we live in an economy and there's a lot that are driving different initiatives. So when you think about kind of making this a more robust, accessible program available at other hospitals, what are the hurdles we're experiencing? Is funding an issue?
Absolutely. Funding is definitely an issue for any kind of initiative where you're trying to add another layer of services. I think that the two main issues that we found when trying to develop this program, one was funding, so making sure that it has a sustainable funding source. And the other is developing a workflow that actually gets these resources to the patients. You all may have experienced this with your own primary care doctors, but there's all sorts of things that often the primary care doctor is a gatekeeper for, in that they have to make the referral for you, or they have to connect you to this or that service. And a lot of times programs can be set up so that, if the doctor doesn't refer you, you can't get in. And so that was something that we wanted to make sure that, yes, we wanted doctors, nurse practitioners, physician assistants to be able to make sure that the patients were able to be referred if they saw something in the clinic, make sure that it didn't depend on that person to get them in. And so one of the big things that we did in our design of the program was to have our financial coaches meet with patients either in the waiting room after visits so that they didn't have to go through the doctor who was trying to get this other big checklist of things done. So that was one big piece of getting the program to be effective. And the second piece, as you mentioned, is funding. Right now, most of these medical financial partnerships are funded by grants, which is great, but it's not necessarily the most sustainable solution. So some of the things that we've been thinking about are who might be interested in supporting these programs to meet their goals. And because these medical financial partnerships have shown things like better show rates at visits, higher vaccination rates among the kids who are participating in these, the clinics have a reason to support these, and insurers have a reason to support these because those are metrics they're trying to meet. And because there are also access points, as we were talking about, through these trusted messengers for these programs like the Earned Income Tax Credit or Child Tax Credit, state governments, local governments have a reason to support these programs because it's bringing in hundreds of thousands, in certain cases, millions of dollars on the city level to patients that are helping the economic activity. So I think that there are some players involved that could provide some more sustainable funding, but that's really the next step for us to get to.
Dr. Gusoff, I want to do one last question. It'll be a little off topic. I know you're out in California, but I wonder what is the view from the medical community out in California when you look and, the big news for us here is this measles outbreak in Texas. It's been primarily in West Texas, but we're beginning to see cases pop up around the state. When you're out in California and you see what's going on here, what are the big worries that you have for your own population, or what are the thoughts that you guys have around what's happening here?
Yeah, I think that one of the big things goes back to what you asked about before, which is how can we be trusted messengers, trustworthy messengers? This is true in LA. I did my training in West Philadelphia during COVID and working in the hospital, where a lot of people in the community, a largely African-American community, had not been treated in trustworthy ways by the health system. So when we came out and talking about vaccines or other interventions, people had reason to be suspicious. So I think that one of the big things it teaches me is how do I double down on efforts as an individual and as a clinic community, as a healthcare community, to be trustworthy, so we can make sure that when we do have an answer, that it is something that is received and that we can actually build on, as opposed to creating suspicion for people of good faith who are just trying to do the best thing for their kids.
Yeah, exactly. And I think that's always important to understand. Physicians don't have a political agenda here, right? It's really just trying to take care of kids and families and their patients. And so I always try to reiterate that in the community when people sort of are, worried about what's going on. So Dr. Geoff Gusoff, he's out at UCLA, a recent article in the Journal of Applied Research on Children. Dr. Gusoff, thank you very much for what you do. And thanks for being on Growing Up in America today. All righty. Coming up after the quick break, we're going to go to Dr. Chris Kulesa, our doctor data.
The one and only.
Yeah, 51% is our piece of data today. Stay tuned. We'll be right back with Dr. Data here on Growing Up in America. Science. I love it, right? I mean, that how old is that song, Brie? You were you even born when that song came out?
I don't think I was, Dr. Bob, but I think we need to hear you karaoke that one more time, just for posterity.
So I don't know, it's that guy. I don't even know who sings that song, but it just reminds me of Back to the Future, and Doc.
It reminds me of Weird Al.
Oh, that's it. Oh, so on the line with us is Dr. Chris Kulesa. He's out of the Baker Institute at Rice University. He's one of the resident scholars out there. Chris, how you doing, man?
I'm doing well, and I am not ashamed to admit that I have been to 3 Weird Al concerts in my lifetime. So
why, Bree and I know you so well, and why does that not even surprise us in the least? So were they good? Well, obviously, if he went to 3, he probably does a pretty good show, Chris.
He does an excellent show, yes, and he's coming to Texas in August. So,
oh wow, I
think we should have a radio outing, you guys.
Really think so? I think I'm rearranging my sock drawer that day. I'm not sure. So.
Very important work.
Of course.
Rico, do you like, I want to ask Rico, do you like Weird Al? I mean, what do you think about Weird Al? Because you're like a music guy, so I'm wondering what.
Yeah, I also have a sock drawer to organize.
Very busy.
Rico Suave on the board. Okay, Chris, what is the data? 51%. I thought it was like Americans who don't get it, but I'm sure that's not the answer. What is the answer for us today?
No, this is from a Harvard study. So that is the percentage of young people ages 14 to 22 who report using generative AI.
Holy cow. So young people at those numbers are using AI. I guess that shouldn't surprise me.
I thought it'd be a little bit higher, actually, just knowing how pervasive AI is right now. But I'm fascinated. What does this mean for kids?
Yeah, what does it mean, Chris?
So it means a couple different things. Now, I should mention that they're not all using it just for cheating. And I will say in my classes, I have seen it happen. I will say not at Rice University.
Of course.
But
no,
I have
never at
students
Rice.
Not at Rice, but I've had students answer exams where they will leave the words Chat GPT in their response.
No.
They didn't even bother removing it from their response. So there's that. But really, it's a shift, right, in education, and it's a shift in how we get information. So the vast majority of those students or of those young people are saying that they're really using it to get more information or to brainstorm. And in some cases, you have students that are reporting that they're using it because they don't feel like adults are being helpful enough to get information.
Wow.
So sometimes there's actually a bit of a problem with the relationship between the educator and the student that's being reported as to why they're using it. But there's other reasons as well, right? So they're using it for artwork, for using it to generate music, or for other reasons. So it's not just about the essays either, or about the exams.
And there's a whole school of thought out there that we should be teaching kids how to use AI, right? Because this is the future. And it's almost like kids now, it's sort of natural to be able to use your phone and to text and to Google and so forth. And in a sense, the next generation is AI is going to be just sort of part of everyone's life, I'm guessing.
It will be, but then there's also a bit of a concern among these young people that AI is going to make finding a job later more difficult, right?
Oh.
Mm-hmm.
So particularly for those that are in some computer science areas or for coding, whether or not AI might actually replace them completely, and whether or not there's going to be a reduction in the work as AI becomes more intelligent, using that word, broadly.
Mm-hmm. Yeah. Wow. And how much, Dr. Data, do you use AI?
So I use AI in my research. I'm actually a PI on a project that is looking at using AI to reduce pediatric no-show rates.
Oh, wow.
So using AI to identify those non-medical drivers of health that we can then modify and tackle so that parents have a better chance of showing up to their pediatric appointment.
Yeah. And how do you feel, Chris, about these people who say, "Oh, I'm not going to use AI. We shouldn't be using AI." And I almost feel like they're putting their head in the sand because AI is here and it's going to continue to develop and it's going to continue to be part of our life. But what's your take on that?
I mean, we really do have to find a way to incorporate it. It's inevitable, as you're saying, right? We're staring at the future when we're looking at AI. And if we don't find ways to adapt it, if we don't find ways to try to accept it, then unfortunately we just ourselves are going to be less competitive, and we're losing out on a tool that actually can be very helpful for us, right? Even as educators, it's something that we can use to try to help build assignments and be able to build material for students. But of course, fundamentally speaking, it should not replace the work that an educator should be doing.
Very good. Chris Kulesa, Dr. Chris Kulesa is Dr. Data. He is a resident scholar out of the Baker Institute at Rice University and our own Dr. Data here on Growing Up in America. Thanks, Chris, for all you do, and we'll see you next week.
See you next week. Take care.
All right, take care. You're listening to Growing Up in America here on Pacifica Radio, KPFT, and Rebecca George, our hip speak expert. She is the generation with the hip speak is going to be joining us, and we're going to get a few words. Are you ready for the quiz today too, Bree, by the way?
I don't know if I am, but I'm excited for it.
You're excited.
I love a challenge.
Very good. We'll be right back here on Growing Up in America. All right, we're back with Hip Speak on KPFT. Well, that's the segment on Growing Up in America. So Rebecca George is joining us. She's out in Georgetown, Texas, and near Austin. And she is our. Rebecca? Are you Generation Z? Is that what you are? Like, are you a Zoomer?
Yes, I am a Gen Z. I am a certified Zoomer.
Wow.
I am proud to be Gen Z.
The hippest Zoomer I know.
You know what? Gen Z, I mean, come on, that's a pretty good little code name. You know, Gen Z sounds really cool, right? I mean, you and I both know differently than that, but I think it's really, it's a cool name. And you're ready for Hip Speak today, Rebecca.
Yes, I am very ready.
Okay, so Bree and I are ready to face the facts and to face this quiz around Hip Speak. So let us hear it.
All right, so the first term I have for you today is the term cooked. Now, there's actually two meanings to it. So if you guess one of them, I will give you correct.
So cooked, COOKED. So I'm going to guess it's finished. It's over. It's cooked. That's my, what are you thinking, Bree?
Are you thinking like a positive or negative connotation there, Dr. Bob? Curious. I'm just going to double down on this quiz. You got two people now.
So I think it's, I think it's probably negative.
Negative?
Is what I'm going to guess. It's cooked. It's negative. It's over.
I'm going to go exact opposite and say positive, as in,
like
they cooked in that speech.
Oh, okay. And who's closer on this one, Rebecca?
I think, honestly, like both of y'all are kind of close. I think Bree is a little closer.
Okay.
Yeah.
All right. We'll give her the point.
So the first meaning could be like someone created something really cool, like someone cooked it with this PowerPoint presentation. So that's one meaning.
Okay.
And then the other meaning, it could be like, oh my God, it's over for us. We're cooked.
Oh, you're right.
Like, so that is a little negative. Yeah. Okay.
Yeah. So one was positive and one was negative. So both of y'all kind of got it.
Rebecca, what are you most likely, as a Zoomer, when you say cooked, what is it most likely for you? What are you using it as?
Oh, I will most likely use it as, oh my gosh, I'm freaking out. We're so cooked. Like, I'll use it more in a negative, unfortunately.
Okay.
That's just what comes with being in college.
Yeah, I get it. Okay, what's our next word, Rebecca?
So the next phrase I have for you is the ick.
Oh, the ick. So I think I've heard a little bit of this. So this is like if you're dating and there's something that just is like, I'm going to stop dating because of this ick. This is the ick that is going to stop my romantic life with this person. That's my guess.
I would agree. I actually used that in my head this morning. I was like, ooh, last night gave me the ick.
Oh.
Mm-hmm.
With your boyfriend?
No. It was national television.
Yeah, exactly. The complete opposite.
Exactly.
Right? Yeah. So, all right, Rebecca, let us know. How did we do on that one?
Y'all hit the nail on the head. So the ick is like whenever you get kind of like turned off by something or someone, like if someone has like bad breath or if someone is like really like a very like annoying person and you're like, ew, get away from me.
That is the
That's
ick.
the ick.
All right, one more.
Y'all got it exactly right.
One more.
My last one is the phrase to lock in.
Oh.
To lock in.
Yes.
What do you think, Dr. Bob?
I'm thinking like you're really focused on this thing, so I'm going to lock in on this. And I think that comes from like playing games, you just sort of lock in on something, right? So that's my guess. How about yourself?
I'm thinking like Jeopardy, like lock in my answer. So like I am 100% certain this is correct.
Oh, you're locked in on that.
Mm-hmm.
Okay. What are you thinking, Rebecca?
So Dr. Bob, you are exactly right. It means to really focus in on something and really focus, no distractions, like very seriously focused.
Locked in. Locked in.
You got it.
So we are locked in that Rebecca George is the best hip speak person that we've had on probably since Becky was doing it, so she's very, very good. So, all right, Rebecca George, thank you so much. And how's college going out at Southwest, by the way?
It's going pretty well. I'm in the heat of midterms right now, so a lot of projects, a lot of presentations, a lot of exams, but all going very well.
And still time to do hip speak on KPFT. That's so great.
Time doing the hip speak.
All right. See you next week, Rebecca. Thanks so much.
Thank you, guys.
All righty. Hey, coming up next after the break, we're going to be talking to Aleah Martin. She's the program coordinator at Youth Build Houston. We'll be talking a little bit about what they do with Opportunity Youth. We'll be right back here on Growing Up in America. We are back on Growing Up in America with Bree, Dr. Bob. How's it going, Bree?
Good. I feel like this is like a dynamic duo, and we get better every week, Dr. Bob.
We get better.
It's a B&B show.
You are always great, but I get a little bit better every week. Right after this, you and I are rushing off to a press conference, though, right?
We are.
So we're doing a big press conference on children, child immigrants, related, and children that are related to immigrants, and bullying in the schools. We have a great statewide lineup on that. So
yeah, and our one and only Dr. Data actually is joining us as well to kind of describe those bullying statistics as well. So his knowledge is endless, truly.
Yeah, so that should be good. I mean, I saw the list of all the people who are speaking, and so it should be a really good group. So you'll hear about that in the news. Hey, on the program with us now is Aleah Martin. Aleah is the program coordinator out at Youth Build Houston. Aleah, how are you doing today? And thank you for being on the Growing Up in America program.
Good morning. Thank you for having me. I'm excited to be here.
It's great to have you.
So for those that don't know what Opportunity Youth is, which is what you guys are working on at Youth Build Houston, give us an idea. How do you define Opportunity Youth?
So Opportunity Youth can be defined as young adults ages 16 to 24 who have, disconnected from the traditional high school track. So they're out of school youth. They could either have dropped out or never went to high school. We have different eligibility factors, categories that they fall under. So they can be from like CPS or foster care system, children of incarcerated parents, migrant youth, teen parents, or some form of criminal justice involvement.
And when you think about Opportunity Youth, Aleah, and the work that you guys are doing, what's sort of the biggest challenge in regards to getting these Opportunity Youth to move from a category that we're worried about them to a category where they're successful?
Oh, it's so many different factors that goes into pushing them to be successful. But the main thing is just being supportive of them, respecting them and seeing them as still human as young people, because a lot of people tend to automatically judge them just from their background or where they're coming from, or because they didn't finish traditional high school, or, just different situations. Maybe they messed up and got caught up with the wrong crowd, so they now have a background, So being supportive of them and being respectful, seeing them as humans, and just giving them that consistency and genuine love, that all plays a big role in their success. Of course, they're pursuing their education, so their GEDs, or they're pursuing these credentials in like construction or healthcare, different things like that. And while also dealing with life outside of that. So, and transitioning from, adolescence to young adults. So it's a lot.
Yeah, it is a lot.
That's such a hard time. I know, like, just from a psychology perspective, like your brain is just rapidly creating new pathways, not let alone trying to understand how to live life. And I feel like when you're disconnected, there's some mentorship that you really are looking for and really need sometimes. So it's hard to really just make growth and make progress there. As you worked with Youth Build, have you noticed any like changes in the challenges youth are facing, or has that shifted at all in your time with them?
Yes, it has. So I actually joined the Youth Build team in 2021. So right after, the height of COVID.
What a fun time.
I noticed that the education levels were, it was tough.
Yeah.
And over the years, since 2021, it's dropped even more, which is sad because myself, I'm a millennial. So, I went through school. We had tech tests, we had all the other testing and stuff like that. But I came out of school with knowledge. Now a lot of them don't have basic math down, basic skills, so it's a big challenge. We're having to start at the beginning with them. And not only the education part, the social anxiety. They were locked up in the house, basically, during the most pivotal time for during their transition of becoming, going through puberty and stuff like that, and meeting and collaborating with other children their age. Well, not children, young people their age, So they missed out on a lot of different social skills, social development. So their social anxiety levels are really high, and a lot of them get very nervous, or they have these panic attacks, and or they choose not to work in groups. Which with our program, we kind of, I don't want to say force it, but we encourage it because it's needed. How are you going to get through life if you don't know how to work with other people? If you don't know how to be around other people? So.
That's such an important part of this, I think, too, that social anxiety, because I know that impacted me during the pandemic as well. And just, you don't get to show up as your best self, as the self you want to be. And that's such an inhibiting factor. And thinking about like a job interview, like your social anxiety can make or break that sometimes. And so as we're looking at like workforce shortages, does that play into it as well? And how's that going for kids or youth, I guess? Sorry.
Yes, it does play a factor in it. And again, that's some of the things that we're working on, workforce development, leadership development. It's just preparing them for the real world in all. Having those communication skills, the emotional intelligence, just how to be around people, basically, because again, that social anxiety plays a big role in their everyday decisions, basically, because they'll opt out of like certain activities, or they may not want to do certain opportunities because they're like, nah, it's too much, it's too many people, or I don't know how to speak in front of people, or it's a lot.
Aleah, final question is, when we look at, as Bree mentioned, there are worker shortages, so there's more jobs out there. But I think what a lot of people don't understand is that for a lot of these kids, without the right skills, without the right training, they don't. It's like fitting a round peg into a square hole, or vice versa. It becomes difficult, and without groups like Youth Build Houston and a number of others right around the state that are really sort of holding the hands of these kids and saying, listen, we're going to make you successful and we're going to do these things and help you get there. There are tools out there, but so many kids just don't know what those tools are. They don't know what the programs are. And so there needs to be some sort of navigation, and you guys are doing a terrific job with that.
Mm-hmm. Yeah, we do our best with collaborating and networking with a lot of other youth programs, not just in Houston, but around Texas, and nationally as well, because Youth Build is a global program. We're in the United States and in other countries. But just in the Houston area, we have so many youth programs, and we've even connected with like HIZ, which is our biggest school district here in Texas. A lot of the youth that are, on a track to basically failing out of school, they send them to us. The courts are sending the youth to us because they don't want them to go out on these bad tracks or bad pathways. So we're considered like a diversion program for a lot of the juvenile centers. The schools, the counselors, the wraparound specialists, we're a resource for their young people, basically.
Yeah, very good.
And Youth Build. So we have our Youth Build Houston. We have other Youth Build programs across Texas, and we just recently started a Youth Build Texas coalition. So we're constantly building up and networking and just trying to expand the movement and provide exposure to the movement, because there's so many resources for our young people.
Of course. Hey, Aleah Martin. Yeah, Aleah Martin is a program coordinator out at Youth Build Houston. Thank you so much for the work that you and your whole team are doing, Aleah. And we hope you'll come back and visit with us on Growing Up in America again. Take care.
Thank you. Bye.
You're listening to Growing Up in America. Hey, coming up next, we're going to go out to El Paso. Chris Salas is going to be with us. He's a professor of social work at the community college there. We're going to be talking about social work and the change that's coming in Texas. All right, we'll talk to you real soon here in Growing Up in America. Y aprovechame hoy, que mañana me voy y no sé cuándo vuelvo. Si en tus ojos me pierdo y nadie le pidió, pero estamos aquí. Hey, I just got news that Mayor Turner, who is now in Congress, just passed away. So Mayor Sylvester Turner, who was sort of a state senator. He was a great mayor. He then served Sheila Jackson Lee's seat in Congress, has been serving there, just passed away. So I'm sure there'll be more of that on many stations here in Houston. So up next here on Growing Up in America, Chris Salas is with us. Chris is a social worker out in El Paso, Texas. Chris, how you doing, man?
Good morning, everybody. Doing well. How about yourselves?
Very good. Very good. Hey, Chris, as you may know, I go out to El Paso quite often, and I was out there, I think it was last year, and a small team of children risk people, we went down to the Sacred Heart Church down there, and we were seeing all the new immigrants that had just been granted political asylum. And I was there with a lawyer who runs our immigration program and one of our social workers. And it was very clear that the person who had the ability to connect most with everyone was Eric Alcala, our social worker. And talk a little bit about that ability of social workers to really connect, Chris, because it seems like we have a better society when we have social workers.
Well, I'm very glad you mentioned that, and we always welcome people to come into El Paso, and remember that we are part of Texas, even though we're a separate time zone.
Yeah, that's right. That's right.
But I really would like to start off with saying that you really just help dispel what people perceive a social worker to be. People believe that us as social workers, we go straight into CPS and take children away from homes, and that's definitely not the case.
Yeah.
To what you spoke to right now, I think that's based on and grounded on empathy and really understanding the importance of human relationships, right? That it's not about going and talking to the person in a suit and going to and talking to the people that hold those official titles. We talk and we make connections. We understand the needs of the people that we are going to help. We are not asking, or let me rephrase that, we're not telling people what to do, but otherwise we are looking at what it is that they need. And we actually are listening to those needs. We're listening to what they're telling us. And I think that really helps in building that trust and building that rapport, to throw some jargon in there.
Yeah.
And that really helps in building that camaraderie, building that relationship with, whether you're in a clinical setting, whether you're in, just like you said, in community building, and just being decent humans, right? Understanding.
Yeah.
I think I mentioned I heard something in your previous interview where your guest was talking about just treating people like human beings.
Yeah.
And I think that's something that is a cornerstone of the social work profession.
I actually almost went to be a social worker.
There's still time, Bree. There's
Hey,
still time.
maybe in the future. But in the meantime, I have so much love for this field, though. And I think that empathy is truly a superpower. And what you guys do is just build bridges. And so when you think about this dynamic, very multifaceted piece of work that you do, what's the most rewarding piece for you? What's most important in your eyes beyond just connecting?
I honestly thought that academic or being an academic would be later on in my life, right? But I fell into this position. Love what I do. Love where I do it at here at El Paso Community College, in my community. Born and raised in El Paso. Lived in Juarez, actually, burning it out in Juarez,
Wow.
right across the border, for 5 years. But having been in the clinical practice, now in the academic field, it just seeing how both aspects, both things, from working with people, helping them achieve their goals, coming in and, I've seen the transformation of people. When I was prior to working at El Paso Community College, I worked as a child therapist. And I recall a young lady coming into my office, covered from head to toe, almost timid of just being there.
Mm-hmm.
And by the time we were done, by the time that we had finished our work together, she was walking, sprinting into the office, wearing a cute little sundress, huge smile on her face. So really just looking at the transformation of people, right? That they're, and sometimes it's within them. What we do is we help them achieve that, what their potential is. Giving them the tools that they might not have, helping them understand, heck, sometimes even just being the person that listens to them for the first time, or the only people that listen to what are their needs, what is it that they want to do. And so being that person, and now in academia, helping my students realize that, hey, you're going to be the instillers of hope. You're going to be that person that someone is going to trust to tell you their deepest, darkest secrets. And they want your assistance. They might not know it just yet, but man, you're going to change their life.
Chris, for many years, the co-host with me on Growing Up in America was Mandy Kimball, who's still with Children at Risk, but she spends her time in Austin passing legislation. Mandy is a social worker, right? And so she is out changing the world, writing lots of great legislation. When you think about the challenges facing our society today, I mean, what would a good dose of social work into the political discussion, what would that do for us here in Texas?
Oh my goodness, how much time do we have?
You have about a minute.
Oh, geez. Right. So I think it would really make, I understand that sometimes decisions are based on business. I understand that some decisions are based on the greater good, but what better, greater good would it be than to assist everybody, right? Here at EPCC, we have different initiatives aimed at mental health, And I always tell all my colleagues, all my students, we try to do things that affect all Tejanos, right? We're the El Paso Community College Tejanos. And I say, it's not about faculty, it's not about staff, it's not about students, it's about all of us. And I think that's what's missing in some of our decision making, that we might, or people might be making decisions that affect the few and realize that there's going to be some results of that are going to impact the people that you least expected.
Yeah.
Maybe not.
Yeah. Let's, I want to move to our, I'm sorry, we're running out of time, Chris. I want to move to our Fast Five, which is always one of our favorite segments where we get to ask you sort of off the wall questions. And I wonder, so Bree had a good one here, which is, when you were a kid, what was your favorite cartoon character?
Again, grew up in Spanish speaking, so I love the Caballeros del Zodiaco, which is the Knights of the Zodiac in Spanish. It still throws me off when I watch them in English.
Wow.
Told you
that was, I grew up in Puerto Rico, but everything that we had was like cartoons translated into Spanish. But my favorite still was Foghorn Leghorn. Do you know that? I say, the big rooster from, anyway, that was always
I am way too young for this.
You don't know Foghorn Leghorn, but you need to get down to, he's very, very funny. All right. The other question I wanted to ask, and then I'm going to let Bree do one. Your favorite food in the cafeteria when you were a kid?
The flat pizza, the pizza squares.
Me too.
Everyone loved the square pizza. How about your big question for Chris?
All right, now I am very into music, so if you could listen to one song on repeat for the rest of your life, and right now we have Jellyfish Jam in the background. I hope you guys know that.
Yeah.
So, Chris, what would you listen to for the rest of your life?
Oh my goodness, my first degree is actually in music, performance, and education. I'm a flute player.
Beautiful.
I'm gonna go complete. I love. This is really random. Beethoven's Fifth, the Fourth Movement.
There you go. Wow.
I'm kind of speechless right now.
Chris knows his music,
He
right?
does.
So, and that's good, right? Because you can when you pick a piece of classical music, it lasts a lot longer than a pop song, right?
Mm-hmm.
So you
way longer. Way more nuanced too.
Chris Salas, he's a social worker out in El Paso at El Paso Community College, celebrating Social Work Month here on Growing Up in America. Chris, thank you so much for what you do, and we'll see you next time. Hopefully, we'll bring you back to the program. And you've been listening to Growing Up in America here on KPFT Radio. We'll see you next time here, Growing Up in America.
With a dream, my cardigan. Welcome to the land of fame excess. Am I gonna